So what is age-related macular degeneration treatment? Macular degeneration treatment isn't very definitive. There is no known cure for macular degeneration as there is, for example, for cataracts. But there are measures we can adopt to reduce the progression of macular degeneration. Now, the safest and simplest thing we recommend is shielding one's eyes from UV light. So it's a very good practice for us all to wear UV blocking sunglasses when we're out in the sun for considerable periods. There have been various studies done about nutrition and macular degeneration, and though not very conclusive, many of the studies show that eating foods good in greens and antioxidants can help prevent or reduce the progression of macular degeneration. So identified nutrients include vitamins A and C and E, and then the elements copper and zinc, and also lutein and zeaxanthin. And some of the companies have made these into special capsules which are now on the market, which we sometimes recommend for patients. When it comes to actual treatment, for the dry type, there is no known treatment that can address it. So we recommend good nutrition and the vitamins, and also we give patients a chart we call an AMSLA grid. It's a square grid with lots of squares in it, which is used for monitoring the progression of macular degeneration, because sometimes the dry type can change to the wet type. So we caution the patients about if they noted any further progression and distortion, they need to report to us for further assessment. Now, for patients with the wet type, there are injections that we can give into the eye to slow down or actually sometimes reverse the damage from macular degeneration. And many patients have been known to have vision restored to a certain extent. These injections have to be given repeatedly, sometimes between every 4 to 8 weeks for several instances, sometimes up to about 8 or even 10, before very noticeable effect is achieved. Once again, for patients with macular degeneration, it's important for them to keep up with their appointments regularly. We're able to detect through various machines. One of them is called an OCT. We can actually measure the extent of the leakage or the area that's affected, and we can determine whether or not it's progressing and whether one needs to have injections in the eye. The injections are performed with an anesthetic, and so it's very comfortable for the patients. The area is prepped and cleaned with antiseptic to reduce the chances of infection, and with the lid open, a very sharp needle is used to penetrate the eye, which causes minimal pain or irritation, and then the injection is delivered into the eye.